All right, we're recording.
Hi, my name is Lisa Miller. I own a small insurance and financial services company here in Arlington, Virginia. And we're here at Senator Jim Webb's Arlington office on Lee Highway to speak up against the health care bill that just came out of the Senate. Basically, it's going to eliminate the private sector, which means they want a government monopoly on health care. Monopolies throughout history have always had a negative impact on the consumer, and of course the investor no longer even has an opportunity because it's a government-run program. Empirically speaking, government monopoly has always had a negative impact on our performance, as empirically shown through the DC voucher system, which they are now eliminating. So if we want to get the best performance at the best price and the best convenience to the client, have a patient-driven system where they can help with their own care, whether it's palliative, hospice, chronic, or simply preventative. It's through the computer systems, it's through obtaining information on themselves from all of their doctors and testing facilities, and being able to discuss this through the computer for second opinions, for rural medical needs, and simply a greater efficiency and a lower price for accessing a doctor and or a nurse. There are plenty of ways that the government now can reduce the cost of Medicare and Medicaid. After all, they're the ones that have the large majority of fraud occurring, whereas the private sector has less than 1%. They need to clean their own house before they go ahead and assume more responsibilities that they are unable to fulfill clearly, as well as and are incapable of overseeing themselves in terms of quality, which is evidenced by the VA hospital that exposed, 10,000 soldiers to AIDS. Is a conflict of interest when government is not only writing the rules and creating anti-competitive advantages and lack of transparency about the real cost of health care, and then them fulfilling their obligations and overseeing their own performance. I think we need to return to commerce, charity, and the individual their rights and responsibilities, and reset government as honest brokers in regulation and oversight, so that our elders, our young, our disabled, our smokers can take responsibility as much as we possibly can financially, and help support the safety net so they have the best services that the market has to offer, because doctors receive the same benefit from a poor person as they would from a wealthy person, up to the extent of their the limit of their benefit. And that would actually increase their value, just as a child who receives their educational benefit, it follows the child to whatever accredited school they get into. And this allows parents to save their own children from failing schools like DC, and it allows Medicaid patients or Medicare patients who are subject to government facilities who receive terrible care to go out into the market and get better services. So I'm asking Senator Webb today to reconsider this destructive, absolutely ruinous bill that will drive up hyperinflation, erode the purchasing power of retirees through their Social Security benefits and fixed income securities, and that would essentially economically ruin this country through, I think they estimate 4.5 million jobs lost, and the Congressional Budget Office has stated that it is simply unsustainable. So they're writing a pipe dream, and they're writing our ruin, and I'm asking them to stop, reconsider, and relook at competitive markets as the best opportunity for the most people. Thank you.
I'm going to give it a couple seconds.